My name is Dr. Elena. I'm with the Global Alliance for Animals and People, and today what we're going to talk about is cleaning ears and putting drops, medication in dogs' ears. Sometimes your vet will give you instructions that you need to give medication at home twice a day or once a day, and what we want to do is just review how you do that. So we have here Elsa and her sidekick Holly, and we're going to do, first of all, sometimes a vet will require that you clean the ears first. Let's imagine that you're doing telemedicine and you're not in the clinic. You might need to clean the ears first if they have like an ear infection or an otitis. So we're going to go after that. Let's have a look at what we need here. So what you need for ear cleaning is some kind of a solution. There's all kinds of commercial products that you can get, and anyone is good. Your vet will probably recommend something that you could use. And then there's different kinds of medication that you can put in their ears for otitis. Some of them are drops and some of them are ointment, but essentially it's the same technique. I usually have a treat for the dogs so that they don't associate with this with something bad. And have some paper towels ready and some gauze. And I just wanted to show you that this is something that we do not use. Something like this, or at home you could find like a Q-tip. This is something we don't use. You don't want to stick anything inside the dog's ears that might damage the tympanic membrane or any other parts of their ears. So we'll just put that aside. We're not going to use that. You could also use cotton. That's another thing that you could use if you don't have gauze. Paper towels are fun, or just any kind of cotton. Okay, so first of all, for cleaning the ears, what we want to do is lift up, this is called the pinna, this floppy part of the ear. So we want to lift this up, and we just want to put some drops in there and hold it so that they can't shake, so that the liquid doesn't fall out. And then you fold the pinna over, and you're just going to give her a nice massage. Oh, that's a good girl, Elsa. Good girl. And what I do is I massage until you can hear kind of a squishy sound. And when you're putting any kind of medication or liquids or ointment in the ear, it's really important that you understand the anatomy of the ear. The important thing to know is that the canal runs vertical, and then it does a right angle turn and it goes horizontal. And this is why sometimes the treatment is not efficient, or it doesn't work, because sometimes that medication doesn't make it down to that horizontal canal that's so important that it reaches. So this is why we do this massage. We want to get right down there. Oh, that's a good girl. Oh yeah. And then once you have that massaged well in there, then you can use whatever you'd like to use, whether that's paper towel or gauze, and just give it a little wipe. You can put your finger in part way, but don't stick it too far down. And just get some of that extra liquid out. There we go. Good girl. Good girl, Elsa. The other thing I want to mention is that in terms of good practices, you don't want to use the same paper towels on both ears. If a dog does have an infection in one ear, and you're using the same stuff to use to clean both ears, then you can easily transmit that infection from one ear to the other. So always make sure that you're using clean stuff from ear to ear. And that goes for these bottles too. They have this applicator. If you put this in and you touch the dog's ear, you can also use that to transmit the infection to the other side. So just take a little bit of cotton with some alcohol and clean off the top. Okay, so you can let them shake. Very good. Sometimes they give a good shake just so they get all of that liquid out. Okay, so that's really basically what you need in terms of cleaning the ear. It's pretty simple. If you need a more advanced cleaning, then I would recommend going to your vet clinic and have the technicians do a proper ear flushing. Sometimes this needs to be done with anesthetic if it's a really painful otitis. But if it's just like Elsa and it's just a little bit of dirt in the ear, then you can just do it like that. Okay, so then what we want to do is put the medication in. It's okay, girl. Stay. Okay, so what I usually do, it's very, very similar to the washing, but you got to be very careful that you don't touch the ear with the applicator. And what I do is I'll often brace anything. If I'm using any kind of medication near the head, whether that's the ears or the eyes, I lift up the pinna again, and I always brace this part of my hand against the head. So what happens here is if Elsa moves her head, I'm also moving with her. If I hold it like this, which is often a temptation of someone, If I hold it like this and I'm not braced against anything and she moves her head, I can shove this right inside your ear, causing trauma or contamination of the tip. So I always put my hand like this. So I lift up the pinna, very similar to the washing, and I'm just going to drop that in. You see again that this is braced like this. So I'm going to drop the indicated number of drops into the ear. And they might ask for 5 to 7 drops, depending on the size of the dog and the type of medication. And I'm stabilizing the pinna here so that she can't shake the medication out. Again, I'll fold it over like this and just massage gently. And usually it feels good if the infection is not too painful. So I'll give her a good massage, and I can hear the squishy sound as the medication runs down the vertical canal again and into the horizontal canal. You usually do this for about 30 seconds with the medication to make sure that it's right down there. And I'm not as likely to let her shake. I'm going to try and discourage her from shaking because I want that medication to stay in her ear. And that's it.